Caring for someone with dementia is one of the toughest journeys, but you don't have to do it alone. I'm Allison Schreier, and my experience caring for my husband inspired me to create Zinnia, a therapeutic streaming service designed to support people living with dementia and reduce caregiver stress. Our research-backed videos are engaging, easy to follow, and they help ease the daily challenges like agitation and anxiety so that you can focus on connection and joy. Available by subscription on mobile and TV apps, Zinnia makes every day a little bit easier. Go to zinniatv.com and sign up for a free trial today. Use the code RESOURCE for 15% off an annual Zinnia subscription.
Hi, everyone, and welcome to Alzheimer Speaks Radio. I'm your host, Lori LeBay, and I'm so excited that you're joining us today. We are going to have a fascinating conversation, as usual, as we learn from people all around the world at all ages and stages of life. Stay tuned as we shift our dementia care from crisis to comfort.
Here we go. What you think about, you will bring about dementia change. We will.
Well, hi, everyone, and welcome to Alzheimer Speaks. I'm your host, Lori LeBay, and today we are going to be talking with author Mark Wilson, and his book is called Breakthrough Alzheimer's Care, and we're going to have an interesting conversation as always. But before I introduce you to Mark, I want to just encourage people to swing by alzheimerspeaks.com. Check out all of our free educational resources. Maybe you're interested in being a guest on the podcast. You can listen to dementia chats. You can find out information and hear from people living with dementia and who are creating art, memory cafes, dementia-friendly communities, our poetry and articles section, and so much more. You can also go to dementiamap.com, which is our sister company, and scope out resources around the world. And maybe you have a service, product, or tool that you would like to submit to the directory. You can do that. There's a button on the first page, or you can always reach out to me at Lori@Alzheimer Speaks. And last, I'd like to give a shout out to my webmasters, Q for Good. They are absolutely amazing. If you are frustrated, worried, stressed out about anything regarding your website, check them out. They know what they're doing. They communicate well. They meet their deadlines, and they're very economical and respectful to work with. So I personally highly recommend them. So with no further ado, let's introduce you to Mark. Well, Mark, I'm so excited to have you on the show. We chatted before, and it sounds like you've had a really interesting journey with dementia. But before we get started, I'm going to have you introduce yourself to our audience, if you don't mind.
I would love to, Lori. First of all, I'm so excited to be part of your show. I've been listening to a couple of your podcasts. It's a fantastic show, so I couldn't be more excited. Yeah, I took care of my mom who had Alzheimer's I took care of her at home for 15 years. And before that, I was an executive in human resources at Taco Bell, where I led the leadership development, training, talent management functions. And then my mom was diagnosed. And I thought, I want to take care of her at home. I don't want her to be in a facility. So I thought, I tried to do it while I was working for a few months, and I realized pretty quickly I couldn't do that. So I left my workplace and took care of my mom full time. And I'm so glad I did, because it was a tremendous journey. She really, really did well at home, and we can talk more about that, as we go through our discussion here. But yeah, no, I'm excited to be part of the show. I learned a lot. I was always being a learning person and head of training and all that. I learned everything I could about the disease, and I tried all kinds of crazy things that really helped my mom in her journey. And now she passed a few years ago. So my new thing is helping other people. So I lead a couple support groups. I do fundraising. I went to DC again to try to get funding for Alzheimer's research. I wrote a book about my experience, and so my new goal now, my new mission is to help people who are working with this disease.
Now, how long did your mom live with dementia?
She was diagnosed probably a total of about 16 years, and she could have even lived longer. I don't know if we want to get into this, but she later in her journey, she had a little touch of pneumonia, and the doctor wanted to do a little minor procedure. Anyway, he did the wrong procedure on the wrong body part, and it was malpractice basically, and led to an infection and sepsis, and she passed. So if this doctor hadn't botched it up, who knows? She might have even lived a lot longer. So,
Wow. Yeah,
yeah,
my mom lived 30 years. Didn't have any
great.
procedures, thank God.
That's great.
But I'm hearing more and more people that 15 to 20 year mark
Mhm.
now, which wasn't heard of for a
Mm.
long, long time. And so it's hopefully going to start changing people's perspective of how to
Mhm.
frame this disease,
Yeah.
because I think still so many of the doctors are giving, 5 to 7 years if you're lucky, type thing.
Well,
And
that's what my mom had. Yeah, her neurologist, who's like a national leading neurologist, said 5 years. And I thought to myself, no, that doesn't work for me. So that's why I put a full court press and all kinds of things that helped her. So
well, that's cool. Well, I'm glad that you've stepped in to try to help other people. Now, writing a book takes a lot of time and a lot of effort. What made you decide to write the book regarding mom's care?
it's a kind of a funny little story because, after my mom passed, I had a close connection with the director at the Alzheimer Center at University of California, Irvine. They call it UCI Mind. And anyway, we were kind of close, and she said, "Well, I'm sorry about your mom passing, but I'd heard you did some really creative things to take care of your mom and applied your leadership experience to leading care team and all that." So she said, "Why don't you do it? We have a podcast series. Why don't you do a podcast or two and share some of your ideas?" So I said, "Sure." So I did a couple of podcasts for the UCI podcast series. Anyway, so people came out of the woodwork after I did a couple of these podcasts. They said, "Oh my gosh, you've got some really creative ideas. I've never heard of any of these things. Why don't you write a book about it to help people?" And I thought, write a book? I don't know anything about writing a book. And it was so funny. I just like next day I thought, well, maybe let me just try. I wrote down some ideas. The next day, some more ideas, and about 7 months later, I had a draft of a book. And then, of course, the publishing process is a little bit challenging for new authors with no fame or platform. But anyway, I got through all that, and yeah, the book is out. It's been out for a couple of months now, but yeah, it was kind of a crazy thing. I had no intention of writing a book, but I thought, why not try it? So
Well, you define kind of caregivers being a bold care leader. Do you want to explain that to
yeah.
our audience what that means?
Well, the intention is a lot of people kind of go into this as sort of caregivers that are sort of like, I don't know if you remember the old cat thing, the cat just like hanging on barely, and it's like you're barely kind of surviving. And my thought was different. I was in charge of leadership and executive development for Taco Bell, and so I thought, no, this is about leadership. I need to take accountability. I need to make things happen because I was determined to have my mom live a lot happier and a lot longer than anybody expected. And so that takes leadership. So yeah, it's hard. I mean, I'm not downgrading the difficulty of being a family caregiver. It's the hardest thing I've ever done by a factor of 10. But you got to put that to the side and say, all right, yeah, it's hard and difficult. But if you really want to help your loved one, you got to step out of that sort of victim mindset and really be a leader and be bold and lead caregivers if you have help, lead the doctors, lead all the people that can help your loved one. And that's kind of that was sort of my intention with calling it a sort of bold care leader. Yeah.
Well, I like that reframing because I think there is a lot of people who feel like they're a victim and have to step into this and this isn't what they signed up to. And when you are giving care, typically you do have to step in and be in charge. You're depending on the difficulties your person has, if it's dementia or heart disease or cancer or whatever. they're going to go through different levels of, being able to make decisions for themselves or to explore opportunities and options available. And so I think setting that up different is good in a lot of ways, because it also tells people that, if you feel you don't have leadership skills, you will develop them because it will happen over time, even if you're resistant to it or not. And I think this world needs a lot more leaders who are able to shift and tap into their own creativity. They know their loved one the best. And so, you can read a book and get advice from people, but I think there's still this string that says that's not going to work for my person, or maybe it's not going to work for me as a caregiver. And so if it's not going to work for me, it's not going to work for them, or it's not going to work as well as it should. So what else can we do? And I think so often everybody is, they want the silver platter with the pill and the cure, and no work and no learning lessons in life. And I think dementia is a great learning lesson of many, many things.
Caring for someone with dementia is one of the toughest journeys, but you don't have to do it alone. I'm Allison Schreier, and my experience caring for my husband inspired me to create Zinnia, a therapeutic streaming service designed to support people living with dementia and reduce caregiver stress. Zinnia offers research-backed videos intentionally created for people with dementia, engaging, calming, and easy to follow. Whether you need to ease agitation, create moments of joy, or make daily routines smoother, Zinnia is here to help. Family and professional caregivers use our content to turn challenges into opportunities for connection. Accessible by subscription on mobile devices and connected TVs, Zinnia is simple to use whenever you need it. Because when caregiving feels easier, life feels better. Go to zinniatv.com and sign up for a free trial today. Use the code RESOURCE for 15% off an annual Zinnia subscription.
Yeah, no, you're totally spot on. I mean, I learned all kinds of things about the disease. I learned about myself. I learned, I drew on different ways to draw strength. In my book, I talk about the number one pillar of great care is you, the leader. And you have to have the mindset and the strength to be a great leader. And you draw on those strengths from two places. One is your internal sources of strength, and then external sources of strength. So the internal source of strength kind of varies by person, but for me, it was a combination of my love for my mom, and love is about sacrifice, at least in my view. And so I was happy to sacrifice for her because I loved her, because she took such beautiful care of me and my sister. And then other people draw on different things. I drew on my faith. That helped a lot. So a lot of people draw on their faith for their internal strength, or just their, pride and self-worth. And then external source of strength are things like, get some exercise, eat right, take care of yourself, and maybe go to some support groups, therapy. Those external sources of strength with your internal sources will strengthen you as a care leader, and you need that, because if you're kind of barely hanging on, you're not going to be happy as a caregiver. You're going to suffer, and your loved one's not going to flourish either. So,
yeah, that's very, very true. And so often we hear of care partners, care leaders, caregivers passing first or getting their own chronic illness because they're not taking care of themselves. I know when I was caring for my mom with dementia, she had that for 30 years. My dad had brain cancer for like 4.5. And all of a sudden I was having some physical issues. All of a sudden I had like sports asthma, and I had indigestion. I had some anxiety. I never had any of those things before, but it was like, okay, Lori, you keep adding on. You're not releasing anything. You're not giving up a damn thing. You're just piling on more stuff and more stress. And then on top of it, I pretty much cut myself off from all social things other than work that I felt I needed to do,
Yeah. Yeah.
and that, I think that was probably the worst of it, was cutting myself out of my own social interaction, because
Hmm.
that refueled me. And I
Hmm.
didn't even know my soul was empty, or getting empty by
Yeah.
giving so much away. And so I think finding that balance is really important. Now, you also talk in your book about going through transitions, and that includes kind of four different mindset
Hmm.
shifts. Can you outline what those are for us?
Yeah, yeah, definitely. Well, the first one is you kind of alluded to. The first one is shifting. First mindset shift to be a great care leader is shifting from I have to do this to I get to do this. And so it's a privilege to reframe it as a privilege to take care of your loved one, because if they have Alzheimer's or another form of dementia, they have the hardest thing going on in their entire life, and they are so desperate for help. So, and this is a chance for you to help them. And so it's a privilege, and you get to make a big impact on their lives, and it's not like a burden it's from a burden to I get to is the first mindset. The second one is kind of, we talked about this briefly too. It's sort of from victim to accountable. And so it's like, okay, you're a victim of this whole situation versus I'm the accountable leader and I can make things happen. That's a really important, shift. So those things are, really critical. The other one you mentioned too is thinking that, okay, well, I don't know anything about caregiving. I'm not a caregiving. I'm not a medical doctor, but the mindset shift is nobody knows more and cares more about your loved one than you do. And so that mindset shift says, okay, well, I may not be an expert in caregiving or an expert in dementia, but nobody knows their loved one like I do, and I can learn everything I need to learn. And that was mindset. I knew nothing about Alzheimer's. I knew nothing about caregiving, but I knew I was pretty good at learning. So I was on a full court press to learn all these things. And I learned, I wasn't an expert, but I learned enough to be a good care leader, to manage others in their care. And so these mindset shifts are just really important because they form the foundation of you being a care leader, and it starts with mindset. So that's the way I thought about these things.
Okay, I think I missed one. So I had, um, let's see, from I have to do to I get to do. I love
Mhm.
that one, because I think that,
All right.
and one of the things I always tell people is, with dementia, people complain about being shadowed all the time.
Yes. Yes.
If I stop, they're going to hit me, because, but, I always kind of frame it as like a small child who has their little blankie,
Yeah.
or
Yeah.
their stuffed animal, and you're not leaving on that road trip till you get that thing in the car. So you better find it, because
Right.
that's their comfort level. And somehow you've become that safety net. And
Hmm.
so for me, I've kind of reframed it to, how lucky am I to be able to give
Hmm.
somebody that great comfort?
Yeah.
Okay, I can have the door open when I'm going to the bathroom if that's what it's going to take to keep.
Exactly.
It's
Exactly.
not a big deal in the scheme of things.
Totally.
And when I became grateful, so much just diminished. It just
Yeah.
wasn't a
Yeah.
big deal. Then you had talked about the victim versus being an accountable leader, and I love that word leader. I think that in being accountable. And then you talked about the I don't know, but I can still learn.
Yeah.
And again, your person with dementia can't always learn. That's
Hmm.
part of the problem here. And so those were three, but I
Hmm.
thought you said there was four. So was I missing one?
It's all about kind of just becoming a mindset of a leader. And those things are all really important.
You also talk in the book about, five breakthrough care
Hmm.
pillars, and that you discovered, on your own
Hmm.
journey, which helped your mom, probably live longer and healthier and be happier. And I think every, care partner out there or care leader is looking for, what are those breakthrough pillars that I
Right.
can explore in our journey?
Yeah.
Can you share those with
Yeah,
us?
definitely. Yeah, it's funny because they just sort of emerged, and I discovered them as I went. So the first one is we talked about it. It's your care as a care leader. Be a strong care leader, and again, you're not going to help them. You're not going to help yourself unless you think of yourself as a leader. If you need to energize yourself and recreate yourself as a care leader, that's the first pillar. That's really important. Nothing good happens without a strong pillar number one, you as a care leader. Second is safety. Similarly, if your loved one is not safe, nothing good is going to happen. They're not going to be happier if they hurt themselves or if they can't walk or break a hip, whatever. So safety is a gateway to the whole breakthrough idea of living longer, happier. And so that's number two. And I talk a lot about safety in the book. There's lots of little things you can do to make your loved one a lot safer, because dementia and Alzheimer's, things happen. People fall, they can choke. There's all kinds of problems, safety issues that are really critical. So that's breakthrough pillar number two, is safety. Number three is find and lead the best care team on the planet. Basically, it's acknowledging that you can't do this alone for 10, 15, 20, 30 years. It's a journey. And I realized after about 2 years of doing it myself that I needed help. And so because I was an HR leader, I knew how to hire great people, and I knew how to lead people. I knew how to coach them. And so I hired the best couple caregivers on the planet, and they helped me with my mission of helping my mom live longer and happier. And so, that's important. And then I talk about the extended care team. So the extended care team are the folks that do other things that you need. Those include your doctors. My mom had physical therapy every week to keep her strong and mobile and walking, which I thought was critical for health and happiness. I had some speech therapy because my mom lost her speech early on. That was the first symptom she had, was losing her speech. So speech therapy.
Caring for someone with dementia is one of the toughest journeys, but you don't have to do it alone. I'm Allison Schreier, and my experience caring for my husband inspired me to create Zinnia, a therapeutic streaming service designed to support people living with dementia and reduce caregiver stress. Zinnia offers research-backed videos intentionally created for people with dementia, engaging, calming, and easy to follow. Whether you need to ease agitation, create moments of joy, or make daily routines smoother, Zinnia is here to help. Family and professional caregivers use our content to turn challenges into opportunities for connection. Accessible by subscription on mobile devices and connected TVs, Zinnia is simple to use whenever you need it. Because when caregiving feels easier, life feels better. Go to zinniatv.com and sign up for a free trial today. Use the code RESOURCE for 15% off an annual Zinnia subscription.
I learned you can get any kind of help at home that you can get anywhere on the outside. And I didn't know that at the time, but I found a home dentist that came. I found home haircutters. Later in my mom's journey, when getting to the doctor was hard, I had a home doctor come. And there's you can get, blood draw. You can get anything at home that you want. And so, but leading that extended care team and your direct caregivers, so important. It makes a huge difference for your loved one's happiness and health. So that's number three, find and lead a great care team. Number four is kind of an interesting one. It's sort of a combination of nutrition and supplements and related things that are critical for your loved one's health and longevity. So I changed my mom's, when I did my research, I changed my mom's diet completely. I added a select number of key supplements. We know doctors don't like supplements because they're not FDA approved. But my philosophy was, if this supplement had some evidence and some people believe that it could help, why not? so I thought, okay, I give my mom a teeny tiny dose, make sure she could take it. There were no side effects. And I did a lot of regular blood works because sometimes you don't know the impact of certain things. So anyway, so I thought, okay, if my mom could take it, why not give her all these supplements? Because I think it'll help her. And then so supplements and medications and nutrition are kind of part of pillar number four. And in my book, I kind of list all the different things that I think help my mom a little bit. And so number 5 is an interesting one. It has to do with creating an amazing surround sound for your loved one. And there's 2 fundamental parts that I discovered to that. One is I call it touch points. I learned that from a project I did at Taco Bell where I was working with the marketing people, and we had 50, you'll love this. We had 15 stores, restaurants in Tucson, Arizona. That was our experimental market. And the head of marketing and myself, we could do anything we wanted with these 15 stores. So we did all kinds of experimental, crazy stuff. And I brought in a consultant that talked about touch points. And the idea was that whatever a customer walks into a Taco Bell, they have feelings. They have images, they hear things, they see things, they taste things. From the moment they consider going there to inside the restaurant to leaving the restaurant. So I kind of thought of my mom's care that way. I thought every moment is a touch point, and the touch point can either make my mom safer, less safe, or happier, less happy. And so my goal was to keep my mom's surrounding physical environment safe and happy. And so the physical environment part was, my mom was a kindergarten teacher, and she loved kids forever. And so the house was like festive. We put stuffed animals all around that she loved. We put all her drawings that she did around, and like you do with kids, you kind of show that what they've done is so you're so proud of. And so we created this fun, festive atmosphere in the house because it was happy and secure, and she was used to it, and she loved it. And then, so that's the environment part. And then the other part is the people environment. So I didn't want anybody to come in contact with my mom that wasn't fun, positive, loving, compassionate. And so that was one of the criteria I had that was very important for not only caregivers, but doctors. If a doctor was rude or whatever, we'd find another one. So, or physical therapy, or whoever had any connection, touches to my mom had to have this fun, caring, loving attitude, because I wanted to create this 24/7 touch point surround sound. So that's pillar number 5. So these pillars kind of work together and reinforce the focus on happiness, love, caring, health, and it all worked together, and it really did work, because again, my mom lived more than 3 times longer than her nationwide neurologist thought she would, and she could have even lived longer except for this jerk doctor that killed her with her malpractice. So
Wow. Well, they're all incredible. You talk about recognizing in yourself the importance of what your role is, that you are a care leader, and I would probably add on to that advocate, because I think sometimes people look at those as different roles, but man, if you're not all over those doctors and the people you've hired, you're screwed, blued, and tattooed. I mean,
totally.
You have to understand what the big picture of what's going on, and you have to have that mission. Like you have a really clear mission of what you wanted to create for your mom, and it doesn't have to be difficult. It doesn't have to be complicated.
Oh, right. It's not.
I'm very in line with you. I had created something called your memory chip, which is just a tool that people can download, and 2 out of the 3 are the same of what you have. Is she safe? Is she happy? And was she pain free? That was kind of that was as simple as it got. And just changing those 3 versus what you've got here with your 5 made a huge difference.
Oh yeah, big time.
In terms of my attitude and those that came in to the environment.
Oh yeah.
I kind of knew the rules and the priorities, because I think so often people don't know the rules or the priorities, and you hear a lot of friends going, well, I don't know what to do. Well, if you stay in these perimeters that you have, it makes it really clear. It's about joy and comfort.
Yes.
It's safety. I mean, this is not a difficult task to do. And if you shift that mindset,
no, you're totally right.
Yeah, getting out of that, oh, woe is me, I don't have time. And the safety portion is so critical, because not only will it harm them, but it's going to complicate your role as a care leader as well. If they get hurt, that's going to add a whole nother level onto what you have to take care of. So there can be a selfish side to that as well. And then, you talk
Definitely.
about finding the best people, who are aligned, and that extended care team, and the ability to think outside the box, like having the dentist or somebody coming in to do somebody's hair versus taking them out.
Yeah.
And, some of these things I know are private pay and aren't going to be covered necessarily by insurance and stuff. So everyone's got to kind of weigh some of those things out. And you talk about the supplements and the nutrition. I think people are typically, what I hear, one of two packs. They're all in and they'll try anything, or they're all out and they're scared. But if you look at even what's FDA approved and the minute percentage of effectiveness, it's pretty small, in my opinion, from what I've seen.
Yeah. No, you're right. Well, that's why my philosophy was, the idea is many, many, many small things. I wanted to make a big difference, and it did. So the idea is, okay, if there's no cure for this disease, just why not try all these things that have some evidence of helpfulness?
Caring for someone with dementia is one of the toughest journeys, but you don't have to do it alone. I'm Allison Schreier, and my experience caring for my husband inspired me to create Zinnia, a therapeutic streaming service designed to support people living with dementia and reduce caregiver stress. Zinnia offers research-backed videos intentionally created for people with dementia, engaging, calming, and easy to follow. Whether you need to ease agitation, create moments of joy, or make daily routines smoother, Zinnia is here to help. Family and professional caregivers use our content to turn challenges into opportunities for connection. Accessible by subscription on mobile devices and connected TVs, Zinnia is simple to use whenever you need it. Because when caregiving feels easier, life feels better. Go to zinniatv.com and sign up for a free trial today. Use the code RESOURCE for 15% off an annual Zinnia subscription.
And that's why I did also kind of on the non-nutritional stuff, like art therapy. I knew that was helpful. So my mom, loved art. So I kind of did a lot of it, art things, music, cognitive kind of stimulation things. I mean, all those things, they don't cure it, but they help a little bit. So I thought, okay, let's just put it all out there and see what happens. And it worked. So, yeah.
Well, and I love, your surround sound. To me, it's almost like going to a museum where they have like an emergent art thing where it's light and sound and just everything. I mean, you take it all in, and it to me, it physically changes my energy, and again, you want to be careful that it's not overwhelming somebody, or, you're not going to have flashing lights and they're going to go have a seizure or something on you, by no person. But, even when you were talking about bringing out her artwork and different things from the past, understanding that they've gone back in time, understanding that we all like to see what we've done recognized and appreciated, and having that, posted or framed or however you did it throughout the house so people can talk about that and reminisce. Those are huge factors. And, the environmental factors, the people factors, again, I think are really great to stay on top of and just kind of have that consistent approach. And I think so often when people are caring for somebody, they see it as a job, but they don't always see that they have control of how that rolls.
Yeah. Well, that's the way I looked at my job. I was the creator of the entire system and the protector of her environment, protector of her daily touch points. And so it's like, okay, it was, it's hard, but it was fun in a way because it was a challenge and the mission was, very important. And so it's like, okay, this is what I'm going to be doing for as long as I can do it. and I looked at it as a fun challenge and an act of love, basically. And I didn't think of it as a sacrifice, even though it was a huge sacrifice. But I thought of it as a challenge and fun and all about love. And I kept thinking, okay, well, if roles were reversed, there's no doubt that my mom would have done the same thing. So it's like, why not? Okay, so.
Yeah, no, that's how I felt with my mom too. Now, not
Yeah.
everybody has a good relationship with
Yeah.
their parent or their loved one that they're caring for, and
Hmm.
that makes it more difficult for some
Hmm.
people to accept the role or step
Yeah.
into the
Yeah.
role. Some people feel forced to be in the role, and then that resentment leads.
Yes.
And I guess I always, and this is just how I was brought up. If you're going to do something, try to do it well.
Totally.
And I
Exactly.
can't do that if I'm feeling resentful or
Hmm.
if I'm feeling drained
Hmm.
and I'm off balance, though I didn't recognize that until I ended up meeting with some friends who kept bugging me to get together. And I kept saying, no, 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 no. And then I went to kind of tell them to stop.
Hmm.
I
Yeah.
can't even take their call. And then that's when I realized I was drained. And instead of
Yeah.
staying 10 minutes, I stayed 2 hours and we laughed and we cried. And I thought, oh my gosh, I had no idea. My soul was so empty because I was too busy being busy
Yeah.
and I had lost myself in the journey. And so I always, tell people you got to find that balance and you
Yeah.
got to do your own check-ins as well.
Totally. Well, you made an interesting point. This idea that, yeah, you may have. I was fortunate. My mom and I were always very close, but I know that there are people that don't have that relationship with their loved one. But the idea is that your loved one needs you more than any time in their entire life. So yeah, if there's a little resentment, a little something, whether it's a spouse or a parent, you know, get through it. I mean, go to a therapist if you need to, kind of work through it and put it to the side and be a loving adult and because realize that if that little resentment takes over and prevents you from taking care of your loved one, then and they don't have a good, successful, happy, long life, you're going to regret that at some point. You will, because I know people that have done that, and they do. They say, "Oh, I wish I would have spent more time with my mother, father, spouse," and they feel bad about it after the fact. So avoid that and just figure out how to overcome that little resentment if something's bothering you about you.
Well, hi, I'm Lori LeBay, and I wanted to tell you about Alzheimer Speaks, which is another great podcast. You see, my own mother lived with dementia for 30 years, and I felt lost. Did you know every 3 seconds someone in the world is being diagnosed with dementia? Odds are it's going to hit your families too. We want to help you connect to services, products, tools, research, and stories so you can be prepared. Please subscribe to Alzheimer Speaks on your favorite podcast platform. Go